September 22 is the World Chronic Myeloid Leukemia Day, and I will take this opportunity to talk to you more about this disease. I am Fadi Haddad, hematologist and oncologist, and I will be talking to you today about the diagnosis of chronic myeloid leukemia, its symptoms, and the different treatment options. First, let us go back to some basics. Our hip bone and our long bones are what we call our bone marrow. They are the factory of our blood. And each day our body produces three types of cells. The red cells, which help carry oxygen to our system so we can function. The white cells, which help us fight infections. And the platelets, which help form a blood clot so we don't bleed in case we cut our hand, for example. And each cell in our body contains what we call chromosomes, which is our genetic code, and each one of us has 46 chromosomes. For some reason that we don't know yet, a part of chromosome 9 and a part of chromosome 22, they fuse together and they lead to a segment and a new chromosome called the Philadelphia chromosome. And we call it the Philadelphia chromosome because it was discovered in Philadelphia. And this chromosome leads to an ignition switch where our bone marrow has a signal to overproduce and keep working all the time, and therefore leads to what we call chronic myeloid leukemia. Now, how do we know that we have chronic myeloid leukemia? There are basically two different ways. The first one is by having our regular blood check, for example, at our doctor, and then we can see that our white cell count is elevated. This will raise some suspicion, and then your doctor should send you to see an oncologist or hematologist and do some more blood work and eventually lead to the diagnosis of the disease. The second method is patients who present with a lot of symptoms, a lot of signs of the disease, such as extensive night sweat, fatigue, a big spleen, which is an organ in your belly that could enlarge, cause pain. This can cause you to lose weight and lose appetite. All those symptoms should lead you to consult your physician, do some blood work, and eventually lead to diagnosis of the disease. Now, once you are diagnosed with the disease, what are the treatment options? Since the year 2000, we had the introduction of new drugs that really changed the history of this disease from a fatal disease to a curable disease these days. We started with the first drug called the Gleevec or imatinib, which was called the magic bullet back then. And it's just a simple pill that you take every day and that will put your disease in remission and under control in the vast majority of cases. Now, with the development and the advances of science, we have newer drugs, what we call the second generation or the newer options, which are three: Sprycel or dasatinib, Tasigna or nilotinib, and Bosolof or bosutinib. They are all equally effective with different side effect profiles, but they all lead to fast and deep responses in patients with CML and can put the disease under a very good control. Now, patients who do not achieve a good result with all these options, we have newer drugs such as iclusig or ponatinib, or more recently Simplex or asciminib, which have demonstrated very high efficacy. So those are 6 different oral drugs that are very effective with different side effect profiles that help control the CML and put it into remission. And now with all those treatments, patients could have really even a normal life expectancy similar to any other normal person. Supposedly this patient is taking the drug on a regular basis, not missing any doses, and eventually after several years there could be also a subgroup of patients who are great responders who can eventually stop the treatment and be cured for life. I hope you enjoyed this video. Don't forget to like and subscribe for more cancer fighting content, and see you on the next video.